Hello, I'm Janine Kakmar with PHTV Channel 4, Palos Heights, and we're back with our show, Healthcare Experts in Your Corner. And on this show, we talk about different resources, health resources in the community, so that, to let everybody know the different things that are available to them. Today, we're here on a special show. We're talking about the measles outbreak that is occurring right now. Measles was actually eliminated in the United States up until 2000. Or in 2000, the year 2000, and today we are currently have a record high cases of measles in the United States. So today I have with us Andrea Quinn. She's a clinical pharmacist at Palos Health. Andrea, thanks for being with us today. Andrea's going to talk to us about measles, the measles outbreak, inoculations, anything, that kind of information that we want to share with everybody about what's going on right now. So thanks for being with here today. I know you're super busy. Thank you so much for taking time out of your schedule to be with us.
Thanks, Janine.
Yeah. I was going to say, let's just start it right away. You know, first of all, we hear measles outbreak. We either got shots ourselves, or most of us got shots ourselves, or our kids. First of all, let's start with, what is measles?
So measles is what's known as an infectious disease, and it's actually one of the most contagious infectious diseases. It's caused by a virus that's known as the rubeola virus.
Okay.
Symptoms of measles can include high fevers, cough, white spots in the mouth, or that rash, that little pinpoint red rash.
Okay.
And measles can actually be very dangerous.
Okay.
In the majority of cases, measles is what's known as self-limited. People get sick and then they get better. But there are cases where the outcomes are not so good.
Okay.
Where 1 in 4 patients that develop measles can actually be hospitalized.
Oh, really?
1 in 10 children who develop measles can develop ear infections, and some of those ear infections can actually lead to permanent hearing loss.
Oh, okay.
1 in 1,000 people can develop what's known as a swelling in the brain, or the big fancy term is encephalitis, and 1 in 1,000 people can die.
Okay.
So it is actually a big deal.
You know,
with measles.
It seems almost like, when I heard that the measles were having an outbreak again, I was like, really? That's like, that seems like such an old-fashioned thing to be going on in today's modern thing with technology and medicine and that kind of thing. So, you know, what's the deal? How did this happen?
Well, I think it's multifactorial. As you mentioned earlier, measles was eliminated in the United States in 2000. Now, that doesn't mean it's eradicated.
Okay.
If the disease is eradicated, that means there's no more traces of it anywhere in the globe.
Okay.
But that's not true with measles. There are many countries where measles is still running rampant.
Really?
Places like the Philippines, Madagascar, Ukraine, Brazil, and numerous other countries. In India, there are still outbreaks of measles, and I think it just read in the paper over 70,000 cases were just diagnosed in the Philippines.
Nice.
So it does occur in other areas. But in the United States, it was eliminated in right around the year 2000. Now, that doesn't mean that there won't be cases of measles still coming up. You can still have an occasional case or an occasional outbreak, but not to the magnitude that it once was. But what's concerning now is we've had over 700 cases of measles identified in the United States from January 1 to April 26th.
Yeah.
So the bigger question is trying to figure out why.
Okay.
Why are we doing this?
So why?
If we go back a little bit in a history lesson, if I may, the measles vaccine first came out in 1951. And many people were vaccinated. And the Center for Disease Control, or CDC, considers you immune to the measles if you've received at least 2 shots of the measles vaccine.
Okay.
Now, how well that vaccine works depends on the time frame you got it.
Okay.
If you were vaccinated before 1957, you are considered what's known as naturally immune, because you probably already had the measles and you've built up immunity for it.
Okay.
If you were vaccinated between 1957 and 1967, you may need to talk to your healthcare provider and consider another redose of the vaccine if you weren't already redosed, because during that time frame, the vaccine was not as potent as it is now.
Okay.
If you were vaccinated after 1967 and received at least 2 doses of the measles vaccine, you are considered what's known as immune.
Okay.
For that. So now if we have this vaccine and we're considered immune from this vaccine, why this outbreak?
Right.
There are still many people who are not vaccinated against the measles.
Okay.
And measles
in the United States.
In the United States.
Okay. By choice.
By choice.
Okay.
By choice. If we look at who is getting infected with the measles from this outbreak, many of these cases can be correlated to people traveling to other countries where measles is more prevalent, and then they've brought it back, and they were unvaccinated, and they shared it with unvaccinated people. As I mentioned, this is one of the most highly contagious infectious disease. So much where if I have measles and I walk into a room of 10 people, and those 10 people are not vaccinated against the measles, 9 out of those 10 people will develop measles.
Now, so you're saying if I walk into it with measles, if I have measles, aren't I sick?
Not always.
Okay.
You can start spreading the measles virus 4 days before you start showing the symptoms.
Great.
And if you have the measles, that virus can stay in the air for 2 hours.
After you leave a room?
After you leave a room.
Well, that creates a big concern for public places then, right?
Absolutely. Absolutely, which is why when the outbreak of measles occurs, they need to try and figure out what caused it and how many people were in contact with those patients for that.
So the symptoms may not show up for 4 days. So you don't know you're sick, but you are contaminating other people. So that's the concern of, getting other people sick and
Absolutely.
So how do you protect yourself?
Get vaccinated. Get vaccinated, get vaccinated, get vaccinated. Make sure you have your 2 doses of the measles vaccine. If you are unsure if you've been vaccinated, talk to your healthcare provider, because your healthcare provider may make that decision to resume that vaccination status.
Okay.
The most vulnerable patients with measles are the young children and then even some of the older adults. However, when we look at the outbreaks that happen, the majority of them are about in the 19 to 30-year-olds for things which are, and again, unvaccinated. The majority of people who have contracted measles have not been vaccinated against the measles.
Okay, and you're saying they're mostly children that are getting it then, or they're older?
Young adults that are getting it for this outbreak, young adults. But the younger children are the ones that are at the highest risk of developing measles and the complications from measles.
Okay.
And how it's spread too is if you think about your communities, if you've got close-knit communities or insular communities where there's not much contact to the outside world and they're not vaccinated, you bring that virus in and you have that exposure to the virus. Remember, 9 out of 10 people will come down with it. And then that's how it's spread.
Is it, okay, so what if we don't know we've been exposed to it? Do we still go ahead and get the shot, or, how does that work?
I think it's important to know whether or not you've been vaccinated. And many of adults our age will have a history of our vaccination records. If we are unsure if we've been vaccinated, it's very important for us to talk to our physician, and then that will be determined whether or not we have immunity already or if we need to be revaccinated.
Now, I know for myself, for example, I know I was vaccinated when I was a child. I don't remember what age. I don't have any records. What happens if I get if I go to my doctor and goes, well, go ahead and get vaccinated? What if I get, is there such a thing as being over-vaccinated?
No.
Okay.
And not for this, not to our knowledge at this time. The CDC, or Center for Disease Control, again states that if you've received 2 doses of this measles vaccine, you are considered immune. However, if we don't know if a patient's been vaccinated, or if I don't know and I'm walking into my local pharmacy or I'm walking into my doctor's office and say, I don't know if I've been vaccinated, I don't have any of my healthcare records, my former physician is no longer in practice and I don't have access to the records. Many times the providers or healthcare providers will just restart that vaccination series, because it's more important for patients to be vaccinated than to take the chance at not being vaccinated. There's no booster vaccines recommended at this time.
Okay, I see. Wow, there's a lot for us to keep in mind. So your suggestion is to just go see your doctor? Absolutely.
My suggestion is if you haven't been vaccinated, get vaccinated.
Many of you don't know if you've been vaccinated?
Get vaccinated.
Okay. And where do they go to do this?
They can do this at their doctor's offices. Many of the community pharmacies will have vaccination clinics as well and can give certain vaccines there.
Okay. So I think that's all we have to cover. There's so many questions we were trying to decide how to share the information. Andrew, you've really shed a lot of information, a light on this information. I thank you so much for being with us today. Thank you all for listening and for being with us, and we'll see you next time.
Thank you so much.